I injured my knee a couple weeks ago doing some vertical and broad jumps, and what I think, I haven't been to the doctor yet, but what I think is I've maybe torn my lateral meniscus, which is a little piece of cartilage on the outside of the knee. So when I open up the joint with these 3 exercise stretches I'm going to show you, takes a lot of pressure off and allows that little piece of cartilage to slip back in where it's supposed to be. It doesn't stay, but I'm going to keep up on it and see if I can avoid surgery in any way. This should also be done even if you don't have an injured knee, because this is preventative, which I should have been doing before this happened, but I kind of got lax on my flexibility and range of motion work. So first thing I'm going to show you is this roller. Now this is called a foam roller, and it's 6 inches in diameter and 3 feet long. And what I'm going to do for this particular injury, I'm going to get down on the floor and I'm going to sit on my right butt muscle. I'm going to put my right ankle on my left knee, and my other weight is on my right hand. I'm going to roll back and forth. Now when I find a soft, tender spot that's a little bit, I would say painful, but I want to kind of roll back and forth and sit on that spot until that lets up. It's like having a massage therapist do some tender point therapy. And I work that butt muscle till it feels pretty good, a minute or 2. Then I get all the way over on my side, and I'm going to work what's called the iliotibial tract, or ITB band. It goes from my hip and then down to crosses my knee joint. And when that's tight, it puts a lot of medial rotation torque on the knee. So in order to loosen that up, I bring this left foot across in front of my right, and I go right down the leg, and you're going to find a lot of tender spots. These are extremely painful when you first do them. After a few days, when it starts to loosen up, it's not as painful. But think of that ITB band. It's actually a sheath muscle like fascia, and when it gets tight, it tends to clump up like when you roll up duct tape. Makes it very hard for the muscle to perform, and when it does, it starts pulling on the joints. So I work my way all the way down to the knee, like that. So that's the second one. The third part is a stretch for my hip flexors. And I'm going to, since it's on my right side, I'm going to keep my right knee down, take a big step out with my left leg, keeping myself upright. Then I'm going to turn and rotate my upper body and reach. And I hold this stretch here. If I have a bar or something, that's great. I try to hold this stretch for about 30 seconds, making sure my knees are in line with my hips, and I stay rotated like this, and then big time pull right in through here and the trunk. Now when I do these, it takes a lot of pressure off my knee joint. I'm able to do a squat without much pain. Doesn't last forever, but I'm hoping that with some diligence and doing this several times a day, that I can possibly avoid surgery. I'm out.